Hello students, just we are continuing the head injury and we have discussed in my previous classes about the injury of the skull, and today we will discuss about the intracranial hematoma. That is the hematoma that occurs under the skull, either in the meninges or in between the meninges or in the cerebrum or in the brain tissue. These hematomas are also due to the injury, that is etiological factors of the intracranial hematoma that occurs due to the severe head injury, either head-to-head collision of the vehicles or maybe due to the fall from the heights, or maybe also homicidal, that the heavy blow on the skull or head, or maybe due to the fall of some heavy objects on the head. So these are the etiological factors of the intracranial hematoma. Intracranial hematoma is also may be associated with the injury of the skull and fracture of the skull. So today we will discuss about the hematoma in the layers of the meninges or outside of the meninges. You know that the skull is covered by three meninges: durameter, arachnoid meter and pia meter. In between the pia and arachnoid, subarachnoid space, there is CSF circulation which acts as a cushion against the blow also. So the first hematoma that occurs, that whole of the meninges is also covered by the skull, that is the skull bones. And this skull bone is very much god-like mechanism which prevents the injury of the brain and meninges. But when the blow is very hard or when the accident is very serious, then the dura or the meninges get also involved in the injury, and blood vessels also that cause bleeding from the meningeal vessels and form the intracranial hematoma. First of all, we will discuss about the extradural hematoma. It is also called EDH. That is, EDH is the extradural hematoma. In abbreviation, it is called also EDH. That is the extradural hematoma. That is the hematoma that occurs between the outer covering of the durameter and under surface of the skull, and this space is very vulnerable for the trauma. When any trauma takes place, the skull gets fractures in association with the dura or the blood vessels between the skull and the dura. The blood vessels that most commonly found in the middle meningeal artery, and most common site of this EDH is the temporal bone injury or temporal region injury associated with the injury of the head. And what is the etiopathogenesis or clinical pathogenesis in extradural hematoma? When any blow takes place, the temporal bone is very vulnerable for the trauma, because it is also cranium is the thinnest bone into the skull, and when any injury takes place, either to the fast moving objects, or you can say by the throwing balls or cricket balls, then the temporal region gets hit hard, and then there is fractures of the temporal bone in association with the injury of the durameter. And here the middle meningeal artery, the anterior branch of the middle meningeal artery, is in between the dura and the inner surface of the skull or temporal bone, that get also injured or severe. And then in this condition there is bleeding from the middle meningeal artery, and collection of the blood takes place in between the inner surface of the skull and the durameter. Durameter, one thing you should know, that durameter is firmly attached to the inner surface of the skull, and then when any hematoma takes place, hematoma wants to get increase in size as the bleeding is continued, and then when there is formation of hematoma and when size of hematoma is getting increased, there is a stripping of the durameter from the inner surface or inner table of the temporal bone and makes a space for its accommodation, and the hematoma remains in between the inner surface of the temporal bone and the durameter, and it acts as a space occupying lesion. As the bleeding, the source of bleeding is meningeal artery, that artery bleeds very fast, and so the EDH, that is extradural hematoma, the symptoms appear very fast, and when there is collection of blood in between the inner table of the temporal bone and the durameter, it strips off the dura from the inner surface of the skull bone and getting increase in size. At that site also the irritation of the third cranial nerve takes place on the same side of the injury, and this third cranial nerve irritation will lead to the pupillary changes, that is, the constriction of the pupil takes place on the same side of the injury, and then if goes on increasing in size, the bleeding is still continue, the size of the hematoma is still going on increasing in size, then the paralysis of the third cranial nerve takes place, and in this case there is dilatation of the pupil on the same side of the injury. And when still the hemorrhage is going on, I am discussing about the etiopathogenesis, how symptoms and pupillary reaction takes place. So when size of the hematoma increase, there is irritation of the third cranial nerve on the same side of the injury, and there is constriction of the pupil, and then if size of the hematoma goes on increasing in size, there is paralysis of the third cranial nerve, and there is complete dilatation of the pupil on the same side of the injury. And again, if you are not treating or if the bleeding is not stopped, then the size of the hematoma goes on increasing in size, and then the intracranial pressure will rise, and the shifting of the midbrain now to the other side, opposite side, and then what happens, there is irritation of the third cranial nerve on the opposite side. Not only this, there is also paralysis or heavy paralysis of the half of the body from above downwards, that is the paralysis of the face on the opposite side of the injury, paralysis of the upper limb on the opposite side of the paralysis of the lower limb on the opposite side of the injury. When increasing in size and you are not treating the case in proper times, then the size of hematoma goes on increasing, and shifting of the midbrain or shifting of the base of the brain on the opposite side then cause irritation of the third cranial nerve on the opposite side, and then the pupillary reaction or pupillary reaction takes place on the opposite side of the body, and then constriction of pupil on the opposite side of the body, and then if it goes on increasing in size and shifting of the brain or the coning of the brain takes place, then paralysis of the third cranial nerve on the opposite side, and then there is paralysis or there is dilatation of the pupil on the same side of the injury, and there is complete dilatation on both sides of the pupil, and it is called Hutchinson's pupil. That is due to the extradural hematoma, the dilatation of the both pupil, which is called Hutchinson's pupil. So these are the etiopathogenesis, how the pupillary reaction takes place, and how the paralysis of the opposite side of the body takes place in case of the extradural hematoma. The extradural hematoma mostly occurs in the temporal region, but it can also occur in the frontal region and may also occur on the base of the brain or behind the cerebrum also. And so the focal signs, the motor focal signs occurs accordingly, depending on the size and site of the hematoma. The clinical feature mostly occurs in case of the extradural hematoma. Severe headache is there in the beginning of the injury, because there is a feature of a space occupying region. Vomiting will take place at the same time, and then there is seizure, that is convulsion will occur, and also there is loss of consciousness of the patient in case of the severe EDH, that is extradural hematoma. So in case of the extradural hematoma, patient will get severe headache, will get vomiting, and then seizure may take place, and there is hemiparesis on the opposite side of the body, and there is pupillary reaction or the dilatation of the pupil or constriction of the pupil can take place depending on the size and site of the extradural hematoma. So these are the features that occurs in case of the extradural hematoma. The clinical signs and symptoms depending on the space, depending like a space occupying lesion. And then we should proceed on the subdural hematoma, that is the hematoma that occurs underneath of under surface of the dura, that is durameter, that is between the rhetoid meter and durameter. This type of hematoma mostly occurs in the old age, and it is venous in the source of hematoma or source of bleeding is tearing of the vessels vein, and also maybe damage or injury of the cerebral sinuses, and so it is slowly giving clinical features, and the patient is not in the beginning serious and no neurological sign is there, but this type of hematoma takes place in the old age, and in the old age when the age becomes more than 70 or 80 years of age, there is constriction of the brain due to the atrophy, and vein between the cerebral spheres and the dura get stretched, and even the trivial injury can cause tearing of the stretched vessels and then the routing of the venous blood in the subdural space. And in the subdural space, the hematoma goes on increasing in size, and it takes time. It takes time, even the weeks, even the months also. It has been shown sometimes the incidences or the cases are also reported that after the injury of 1 month, the patient developed the features of subdural hematoma, and death of the patient is issued due to the not treating properly. And so subdural hematoma is very serious in case of it, although it is slowly growing, but it may be also acute subdural. It can be divided into the acute subdural hematoma and chronic subdural hematoma. In case of the occurrence of such type of the injury, that is, there is lucid interval when there is first time injury, when head injury takes place due to the primary injury of the brain. The patient becomes unconscious at the time of the injury, and then get consciousness just after a minute or 2 or even 5 minutes, and getting consciousness, patient becomes alright. Then for the time being he is very alright, and he is responding all the activity, and but slowly after an hour or after 5 minutes or 10 minutes, when the size of the hematoma goes on increasing in size and then cause pressure on the hemisphere or on the brain tissues, then the patient again become confused, complaining of severe headache and confusion is there and seizure will occur and then patient become loss of consciousness. So there is two period of consciousness, that is the two times of unconsciousness is there, and the interval between the two unconsciousness is called lucid interval. That is the time interval between the two unconscious period is called lucid interval. When the lucid interval is a smaller one, the patient is more serious, and when lucid interval is longer in time, the patient is less serious, because it occurs due to the fact that at the first time when patient get injury, there is primary injury of the brain and a stretching of the brain tissue, get loss of consciousness at the same time, but again consciousness again, but as bleeding goes on continuing in subdural space, and it is much bigger to produce the pressure on the brain, and then patient become unconscious again, and then subdural hematoma. The lucid interval, if it is a longer one, it is simple, and when it is a shorter one, it is more serious. Sometimes chronic subdural, this is called acute subdural hematoma. Sometimes chronic subdural hematoma takes place in the old age. That is the stretching of the blood vessel to the atrophy of the brain, and there is tearing of the stretched vessel to the trivial trauma to the old persons by falling or by this way or that way, and there is losing of the venous blood to the severe stretching, and there is losing of the venous blood and collection of the blood into subdural space, and even in months or even in weeks, they produce a space occupying lesion, and then the patient develop frank clinical features of the subdural hematoma. So chronic subdural hematoma, it is more common in old age, but acute takes place in the injury of the brain, and it is in younger age group. So these are the clinical features, mode of onset of the hematoma, intracranial hematoma, and also clinical features of EDH and SDH. Sometimes the subarachnoid hematoma occurs, that it will also be head injury, and maybe that in this case the bleeding takes place in the blood vessels in the subarachnoid space, that is the space between the arachnoid and the pyometer, and in this space, it is called subarachnoid space, in which there is a circulation of the CSF. So in this case, the bleeding occurs, and blood is mixed with the CSF, and this CSF is mixed with blood, and then blood mixed CSF will coming out and makes a clot in the space, and this clot goes on increasing in size. In the beginning it is a small one, but in the later stage there is imbibing of the CSF also, and imbibing of CSF due to the less density of the hematoma, and the hematoma gets swollen, and then become bulbous and occupy more and more place to give the feature of the space occupying lesion, and then all the symptoms and signs of the EDH and SDH will appear. That is, the severe headache will be there, seizure will be there, vomiting will be there, and there is loss of consciousness will be there. So these are the intracranial hematoma, by which sometimes the severe head injury, that is the intracerebral hematoma, is also kindly included in this. The intracranial hematoma, intracerebral hematoma occurs with the severe head injury and due to the head and head collision, or even in the air crash, aeroplane crash in which there is severe type of injury, and there is tearing of the cerebral vessels, major cerebral vessels, and when bleeding occurs into the brain tissue, is very irritable, and patient will get unconscious, and maybe injury may be so serious that you cannot find such type of injury, and most of the persons get its death at the time of the injury, because the injury is very serious and serious injury is there, and clinically we found the intracerebral hemorrhage due to the fact that the severe head injury takes place and death of the patient occurs at the site of accident. So this cerebral hematoma can also occur, and there is irritation of the blood into the cerebral tissues, and all the features and clinical features, signs and symptoms will occur like other EDH or SDH. The patient become unconscious, loss of consciousness is there, and there is all other features of head injury will be there. So these are the 4 types of hematoma. Intracranial hematoma, you can describe the intradural hematoma, EDH, the subdural hematoma, that is SDH, and subarachnoid hematoma, that is the hematoma in between the pyometer and the durameter, and last one is the intracerebral hematoma, in which there laceration of the brain or tearing of the blood vessels which takes place, and intracerebral hematoma can take place, and it is very serious conditions. Now, how will you diagnose such type of hematoma, intracranial hematoma? Just when you will receive the patient in the emergency, you resuscitate the patient first and find out the seriousness of the patient by the Glasgow coma scales, and then investigation should be done by the plain X-ray of the skull. You can just get the plain X-ray of the skull, and you can find out the linear fracture of the skull bone, and along with linear fracture or the split fractures of the skull bone, there is a stripping of the blood vessels and oozing of the blood from the fractured part of the skull that collects into the subdural space or extradural space, depending on the site of injury, and then you can diagnose there maybe in plain X-ray that is fracture of the skull bone, either split, compound or simple fracture takes place, and then you can think about the intracranial hematoma. The another investigation is more reliable and more perfect, that is the PET scanning, that is computerized tomography should be done in case of the head injury, and then when you are doing the CT scan, the CT scan will tell each and everything about the hematoma. They will tell about the fractures of the skull bone also, and in case of the PET scanning, you can differentiate between the EDH, that is the extradural hematoma, and subdural hematoma, because the extradural hematoma is convex in the X-ray, in the plate of the PET scanning, and that is biconvex, that is the convexity is there in between the brain tissues and the skull bone, and this biconvex limited, it remains in the limited site or shape. But in case of the subdural hematoma, because the subdura is attached to the suture line and there is a space between the subdural space, so hematoma when it takes place, it can go bigger one, and this will circulate into the half of the hemisphere of the skull bone, and so the in case of the PET scanning, this subdural hematoma is larger and concavity is towards the brain tissue, and then you can diagnose by the PET scanning whether it is the extradural hematoma or subdural hematoma. And then you can diagnose it in a better way. On clinical aspects also, you can also find out which side of hematoma is there. One thing you should know clinically that on which side hematoma should be there, and on which side burr hole should be done for the extraction of the hematoma. So decide on clinical aspects, you can decide the burr hole, the treatment is only to evacuate the hematoma by doing the burr hole, and burr hole which side should be done, you can decide either by clinical examination or by the special investigations. The CAT scanning is the most perfect on this side hematoma is there, but on clinical basis the hematoma only occurs on the site of the injury first. Second, the hematoma, subdural hematoma or extradural hematoma is also always on the opposite side of the paralysis of the body. And third, that the hematoma occurs only on the side where the pupillary reaction, that is the irritation of the third cranial nerve or constriction of the pupil on the same side. So you find out the pupillary reaction, and then you find out which side constriction or irritation of the pupil is there. On that side only you find the burr hole. But the CT scan is the final supreme judgment regarding the site of the subdural hematoma or extradural hematoma, and then on the same side burr hole should be done. And after doing the burr hole, you expose the dura. Dura is dusty in the case of the extradural hematoma, and you can evacuate it and aspirate properly, and then the patient will get fantastic recovery and dramatic recovery will take place our deprecation of the hematoma. If there is subdural hematoma, you open the dura mater and evacuate the whole of the hematoma, and then patient will recover very soon. Dramatic recovery of the patient takes place. So this is all about today, that you should know about the intracranial hematoma, that is the three types, that is EPH, extradural, second subdural SDH, and third is the subarachnoid hematoma, and fourth you can say the intracerebral hematoma. You can clinically find out and know what type of hematoma is there on the basis of investigation by the CT scan, looking the size and shape of the hematoma in the plate or in the computerized scan. You can find out whether the hematoma is extradural or subdural. Extradural hematoma is shorter one, with the fact that the dura is attached to the inner table or inner surface of the skull very firmly, so stripping of the dura limit the hematoma size of the hematoma. But in case of the subdural hematoma, the space is very open, half circle, and only it limits at the its union to the suture line, and so there is a spread of the hematoma in bigger space and can continue towards the brain tissue, and in this way you can diagnose it and treat the hematoma. Thank you. This is all about today.